second talk. Robert Ang will give the first one. And this is really looking at how do we potentially restore accommodation without putting an IOL in by working on the sclera.
Good morning and thank you for having me. We're now going into non-cataract patients, so presbyopic patients who search for a solution. So we started from cornea, lens, sulcus, and now we're trying something on another part of the eye, which is the sclera. So I'm a consultant and investigator for ACE Vision, which is one of the developers for this technology. So as a background, presbyopia, when we're talking about it, starts at age 40 and going back to physiology, it's rooted to advanced glycation end products wherein our sun exposure causes cross-linking effects in different parts of our body, including our eyes. And one of the most exposed areas of the eye is the sclera. So as you grow older, more cross-linking, more stiffening of the sclera, so it prevents the accommodation reflex or slows it down. So that's the theory behind this therapeutic advances. So as you can see, when you're young, your lens is very flexible. Your lens is attached to the ciliary muscle. It's attached via the zonules, and the ciliary muscle is attached to the sclera. So we can't touch the ciliary muscle, we can't touch the zonules. So can we modify the sclera somehow to help with accommodation and improve dynamic range of focus? So decreasing ocular rigidity is one of the theories behind resolving presbyopia. So we want near focus to improve. We want it physiological, which is arm's length, but we don't want far vision to change. So how do we do it? So in this laser scleral microporation, we cover the cornea with a shield so that we don't fire anything on the cornea. An erbium YAG laser fires multiple shots, creating pores, partial thickness in the sclera in 4 quadrants. So the goal is to rejuvenate the whole complex of sclera, ciliary bodies, zonules, and lens so that it continues to function or rejuvenates the function again. So we did a study. We started about 3 years ago on 50 patients. So this is purely on emmetropic presbyopes. It does not include correction of refractive error. We recruited patients with a mean age of 52 years old, and they had to have reading glasses of at least 1.5 diopters, but no distance correction. So they had to be happy with far. So this is the procedure. So we have this handheld. So this is the generation 1 laser. It's a handheld laser that fires these YAG shots in the sclera in 4 quadrants in a diamond grid pattern. So 4 quadrants will get treated with this 75 to 80% depth pores in the 4 quadrants to relax the sclera and hopefully promote movement again with the ciliary body and the zonules. So the goal is to provide a minimally invasive treatment. Second is do not touch the visual axis. So we don't touch the cornea, we don't touch the lens. And we are in the next stages of doing studies if we can repeat it or augment it in the future. So at day 1, most patients feel that their near vision has improved, some more than others. You see the pores, the conjunctiva has healed because it's transconjunctival treatment. So first few days, they will feel a scratchy movement. The best thing about it is the most common adverse event is a subconjunctival hemorrhage. There's no other adverse event or complication we encountered, and we just treat them like any conjunctival abrasion or corneal abrasion. So one thing we check is, are we inducing any corneal or refractive change? So these are checks in terms of cylinder change. Are we inducing any type of coma effect or astigmatism effect over 24 months, and you see the plots that the cylinder is still within the middle, so we're not cheating by inducing any refractive change. So sphere itself has maintained. Of course, over 12 months, the patient continues to age, right? We cannot stop aging, but we monitor the sphere and the cylinder and the MRSE of the patients over time. And as you can see in the graphs, both uncorrected and distance corrected, the green line represents distance vision. They're mostly flat because they still see well for distance uncorrected. Intermediate vision has improved a lot. So the blue line is intermediate vision, and the near vision also improved. But mostly it's a very big intermediate vision gain over 12 months. But over time, they age 2 years. So this is a 24-month plot, no, of patients. Reading glasses are less. It is not a J1 procedure. We were not able to achieve J1 in these 50-plus-year-old patients, but about J3, J2, J3, reading glasses are less to none, and they have a significant reduction in reading ability. Subjectively, they have less stress in terms of the fatigue in reading. So we also had quality of life questionnaires, and we see a very big improvement in intermediate vision for the patients, computer, cell phone, and all that. Near work, of course, sometimes is still a challenge for these patients, but there was improvement. So, in conclusion, our study showed that the first phase of our study was safety. Are we causing any adverse event? Second is, are we causing what kind of effect? We have good intermediate and a modest amount of near vision. It reduced their dependence on reading glasses. The most important feature is we reserve the cornea and the lens for future use, and it improves their quality of life. So this is laser scleral microporation using an erbium YAG laser on emmetropic presbyopes. Thank you.